Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You begin by checking pain and signs of inflammation so you know how aggressively to move. Start a 5–10-minute gentle range of motion and low-impact warm-up to increase synovial fluid and reduce stiffness. Once done, apply ice for recent swelling or heat for chronic tightness for 10–15 minutes. This reduces pain and prepares tissue. Make sure footwear and a supportive brace are ready, because proper support changes load and prevents compensatory strain. You now shift into controlled loading to strengthen muscles that protect joints. Start with low-impact cardio like swimming or cycling for 20–30 minutes to boost circulation without excess wear. Once comfortable, add progressive resistance 2 to 3 times weekly, aiming for 8–12 reps to build endurance and support. Increase load slowly. Make sure to prioritize perfect form and core stability so the joint moves through a safe range. If pain rises, reduce intensity and consult a. You finish by turning gains into lifelong habits. Schedule regular strength and cardio, track weight, and use mobility sessions to keep joints supple. Once maintained, taper intensity during flares and switch to cross-training to avoid overload. Make sure to monitor warning signs, persistent swelling, night pain, or progressive loss of motion, and seek medical evaluation if those appear. Troubleshooting tip: if a flare won't settle, stop offending activities, use ice and short-term NSAID per guidelines, and contact a clinician.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.